Good evening, everyone, and welcome to the Australian Veterinary Acupuncture Group Free Members Webinar Series on canine rehabilitation. Tonight's webinar is the first in this series of 4 by Dr. Kim Lim. Tonight's presentation will be the top 10 tips for canine rehab. Many of you know Dr. Kim already, so I probably don't need much of an introduction, but for those who don't, Dr. Kim graduated in veterinary science with honours from the University of Melbourne in 1990. She became a certified veterinary acupuncturist in 1992 and received her Master of Animal Chiropractic from RMIT in 2003. She is also a certified canine rehabilitation therapist. Since 1996, she has worked solely in integrative complementary medicine using rehabilitation, chiropractic, acupuncture, craniosacral therapy, bark flowers and homotoxicology. Kim has been a past president of the Geelong branch of the Australian Veterinary Association and the Australian Veterinary Acupuncture Group. She has also been a lecturer in both the animal chiropractic and the veterinary acupuncture courses. Now, just a few brief housekeeping before we begin. Firstly, if anyone has any questions, as Kim goes through tonight's presentation, on the bottom left of your screen there is a chat box. You're welcome to type your questions in there. Unless we see something really urgent, we'll hold answering questions until the end of the presentation, and then we'll present them to Kim then. In the bottom right hand of your screen you will find a small file folder, and there that's being highlighted by a yellow marker. There you will be able to download a presentation of tonight's PDF for your future reference, and that will also be put into the chat box as a download as well. So without further ado, I will hand over to Kim for tonight's presentation. Thanks, Kim.
Thank you, Claire. And thank you all for taking the time to spend this evening listening to my take on the top 10 tips for rehab. Over the last 20 years or so, I've been incorporating rehabilitation ideas into my practice after initially completing my RMIT graduate diploma in animal chiropractic. Since then, I've scavenged ideas from my chiropractic, osteopathic and acupuncture colleagues, from the horse world, and I even attended a brain gym PD for teachers way back when my daughter was about 6 and starting primary school. I sat in a group and they all said, you know, we come from the disability area, I'm an integrative teacher. And I said, oh, I'm the vet, you said I could come. Anyway, you never know when you're going to get your next great idea. So let's start. So this is me. There's my email and my phone number. Feel free to contact me afterwards if you have any questions that you haven't thought of straight away. Here's my number 1 tip. Let's get straight into it. So my number 1 tip is about timing. When do you do what in rehabilitation? And this came about because a few years back, people would come to me for musculoskeletal problems and maybe after surgery, and they'd say, well, my vet said to go swimming. And swimming was really popular. Swimming kind of became the word for rehab, and swimming is not rehab, and we'll talk about why a little bit later in the webinar. So I kind of break rehabilitation and healing into 3 phases. We've got our initial inflammatory phase, and then our regeneration and remodeling phase, and then lastly the remodeling and strengthening phase. Okay, so water can be used, water therapy can be used in all 3 of these phases, but it is most commonly and most useful in this last section, in the remodeling and strengthening phase. And we'll talk about that when we get to that part of it. So, phase 1, we talked about that initial inflammatory phase. So when I explain that to my clients, I say, well, that's the ouchy bit. That's when you've just sprained your ankle. It's at the acute phase, and we've got to undo the problem. We don't want to add more layers to it. We've got to undo what's already wrong. Okay, so in the example of an acute sprain of an ankle in a person, you would stabilise the joint, relieve pain, stimulate healing, all those sort of things. And for the acupuncturists out there, we've got good acupuncture recipes and patterns for pain and for healing. And then in the second phase, that regeneration and remodeling phase, this is where we fix it. First we undo what's wrong, now we fix it and we give the right recipe to the body. Okay, and then in our third phase, this is where we reinforce that pattern. We do our strengthening. So we're strengthening the timing, the coordination, the movement, the muscles, all those components. And this is where the hydrotherapy, your swimming, your running, hill work, steps, those sort of things, the workout type stuff becomes useful. Okay, moving right along. Okay, let's go back to phase one, where we undo the problem. So our main components that we need to fix are pain and swelling. And the acupuncturist, again, I like using my electrostimulator at this stage. As long as you haven't got a surgical wound, you know, then you've got to wait for the stitches to come out and that sort of stuff. But if it's not a surgical wound, you can do this from day one. This is my little way of doing it. I wrap the joint up in a saline soaked bandage and stick the electrostimulator on at 100 Hertz for 3 minutes at high intensity. So here are some pictures. This is my little unit. It's small. It's not as high powered as some of the others that can cope with 4, 6, 8 leads. But because I mostly move around on my push bike, it has to be something that's small and transportable. Okay, and this is what I do. Wrap, in this case, if we're using a cruise ship model, wrap the joint up with a saline soaked bandage. Doesn't have to be anything fancy. This is an old nappy, but I've been known to use chuckses and whatever I can get my hands on. And then you connect your leads up, negative to positive, in a crosswise pattern, 100 Hertz for 3 minutes. When I finished the CCRT course, the CRI course, I bought myself an NMES unit and gave that a go. But the fiddliness of handling gel pads and trying to hold them in place and then sticking these pads on for 20 minutes was just all a bit too much for me. So I've gone back to this because the electrostimulators always worked for me for the last 20 odd years and I'm happy with it. Okay, so in phase one, not only do you have a joint or that part of the body that is reactive, but there's secondary patterns that we need to deal with. So if you've been holding your leg up for a while, you're bound to have incorrect muscle tension in your hip flexors or, you know, that part of the body. And because you're holding your leg up, you're kind of a tripod and you'll have spinal compensations as a result of that. So we can take advantage of the knowledge we have with acupuncture using our proximal and distal points to relieve some of this. Here we go. Those of you that turned up to my lecture at the AVA conference will have seen this. And let me have a look. What do I do? Here we go. We can use our proximal points. So if you're looking at the cruise ship model again, these are our nerves going down a leg that originate at the lumbar region. So we can use our bladder meridian points. We can use the gallbladder meridian, which I'll show you in a minute, for the hip flexors, and obviously the local lumbosacral points are part of that nerve going towards the leg as well. Here we go. Here's an example of using acupuncture distally to affect the knee, because you can see that the meridian goes down past the stifle down to the knee, and for the acupuncturist, bladder 60, the aspirin point, good for pain and inflammation. Here's your gallbladder meridian. We talked about using the gallbladder meridian in stifle conditions, gallbladder 41, and distal point, good for joint pain. Okay, Jing points. So here we go. Bladder 67, gallbladder 44. The endpoints and meridians are known to drain excess heat and heat from the channels. So good for acute problems and for pain as well. And they're not in that local area. Why don't we acupuncture in the local area if you've got a problem, let's say in the stifle? Because that joint is already inflamed, if you're going to stick lots of needles there, you might actually create more reaction there. And we're trying to get rid of pain, get rid of inflammation. We try and avoid that area in its acute phase. Okay, so that number one tip was timing, when to use different things. The next concept we're going to look at is the dysfunctional joint stiff, tight, weak, or is there pain? Because each one of these components has a different technique associated with it. Okay, here we go. So for joint stiffness, I explain it to my clients with the analogy of a rusty hinge. When you're trying to open that door and it's a rusty hinge, it's going to be really hard. So you've got to get it moving. You know, if you haven't got any lubricant, just opening and closing that door numerous times will work that hinge loose. And we can do the same for our dysfunctional joints that are stiff, the old arthritic dog type stuff. And it's true. I say to my clients, if you don't use it, you lose it. But there's ways to use it to make it work for you. From a TCM point of view, arthritis can be seen as one pattern is the B syndrome. So from a Chinese medicine, it's explained as the invasion of Chinese TCM, wind, cold or damp of the joints, and it blocks the flow of qi in the meridians. Commonly with kidney yang or yin deficiency, because kidney is associated with bones. Here's a little couple of tips for you. These are the Chinese herbal formulas that I like. Duho Jishen Tang for stifle and low back pain. Tendon ligament formula is a Jing Tang formula. And sometimes when the Duho is not quite enough, I might try this just for a bit of variation. So Duho Jishen Tang will eliminate damp, which is when things are heavy and stiff. And it also warms and supports that kidney, meridian and organ concept. Okay, so we're on to tip number 2. Get it moving. There's 2 ways to get it moving. You've got active movement, which is when the dog moves itself. And you've got passive movement, which we'll talk about a little bit later. So with active movement, things have to be, so, you know, if you go back to that rusty hinge, if you're trying to yank that door open and close a lot, well, you could break that hinge. So you've got to go gently with it because you don't want to cause pain. We're still at that initial phase. So go gently. You could use lead walking. And this is where we could use a bit of water. So if you're thinking of the IVDD dog and it's not able to stand up, you could use water to get it to stand up. So sometimes in those cases, not in the acute phase, but just a little bit later, I get my owners to put a non-slip mat in the bathtub, fill it up so that the water would come up to like shoulder or hip height, and just stand the dog in it so it's able to stand if it's got a little bit of strength. Okay, so what sort of walking? So, you know, there's all sorts of, and a lot of my clients will say, well, how much do I do and how far and all that sort of stuff. The most important thing is to get the dog to walk slowly. And what I mean by slowly is that you've got to make it go slow enough that it uses the body in as normal a gait as possible. So if it's got a cruciate issue and it's walking like a tripod, if you walk it slowly enough, it will actually put that leg down. And my analogy is of someone riding a push bike. When you're going fast, it's easy to balance. But when you're going slow, it gets harder and harder to balance. So then when you're walking slowly, you actually need to put that leg down or you're going to fall over. So anyway, and that works really well. And most people, you know, they just let their dogs go at the speed that the dog's comfortable in, which means lifting that leg up and hopping along. Now, how much and how far? In the initial phases, I try and aim for short and frequent. So it could be something like 5 lots of 5 minutes in a day, and then increasing by 1 lot of 5 minutes per week. So in that first week, it's 5 lots of 5 minutes. In the second week, you've got 4 lots of 5 minutes and 1 lot of 10 minutes. And in the third week, you'll have 4 lots of 5 minutes and 1 lot of 15 minutes. So the 4 short ones are to get the joints moving. And the one that increases each week is to build up the stamina. And you know, obviously you've got dogs that are reluctant to walk because they haven't done it for a long time, or they're very obese. I've had a Cavalier recently that was so obese that it would poo lying down because it just couldn't get itself up. But it was very food motivated. So every meal time, the owner would take its food bowl for a walk around the garden. And then at the end of it, because the dog would follow that food bowl, it would get its reward. So there's ways of doing it. The other thing that was brought up recently by a client was when I said, well, you've got to go for a 5-minute walk. And they said, right, there's no mucking around, no sniffing at trees and stuff. And I said, well, no, actually, that's really important. Sniffing at trees makes you lower your head. If you have to squat to go for a pee or cock your leg, that's changing your posture. And that's good to help recondition the body to its various postures. Okay. Next slide. So we're up to tip number 3, passive movement. And what can we do there? So passive movement is a very gentle form of exercise that can be started the day after surgery. It's that gentle, okay? And when it's gentle, the aim is to get circulation going, and it will speed up healing. Get your tissue fibers aligned in the direction of tension so that when you're at the remodeling phase, there's less remodeling required because those tissue fibers are already being laid down and aligned in the direction of tension. And it will help maintain that flexibility as well. So let's have a look at these 2 videos. All of these videos, if you want to click on them at a later stage, they link to YouTube videos. So it's nice and easy and you can watch them over and over again if you wish to. So can we have the video playing? There we go. So this is what I call a joint pulse. Now I've got my fingers on the distal femur and the proximal tibia. Let's just pause it there for a sec. And I'm holding them firmly but not tight. And I'm compressing my hands together. Okay, so it's a very gentle process. I say to my clients, look, if you can see your hands moving, you're going too hard. And I go slow and gentle and imagine the waves coming into the shore and going out again. So nice, easy, relaxing kind of rhythm. That's what we're after. Have another look. You can hardly see my hands going. There we are. So, and the next form of passive mobilization I want to talk about is the passive range of motion, so PROM, as you remember from the previous slide. And in this case, we're kind of just pumping that joint, but in a gentle way without force. Oh no, it didn't say properly. So, well, that didn't work. Anyway, what we're trying to do here is to bend and extend the joint. Hang on, let me get, bend, here we go, here's my arrow. So yeah, so I'm going to bend the joint and extend it, bend it and extend it in a nice relaxing manner. There we go. And you do that 5, 10, 15 times. So what it's trying to promote there is circulation as well as flexibility without causing pain. Okay, so can we move on to back to the slides? There we go. Okay, so the idea, the thing to remember with mobilization is that hard and fast stimulates and slow and gentle relaxes. So if you want something to relax because we're trying to free things up, you've got to go slow and gently. Okay. Next. So tip number 4, mobilized by proxy. What do I mean by that? So I've had chiropractic training, but a lot of you haven't. And if you're not a chiropractor, you kind of think, I don't know how to adjust. I might hurt the dog and I might definitely blow a hot disc. There's no need to panic because I've got little special tricks to overcome that lack of ability. Not that I'm not encouraging you to look at the graduate diploma in animal biomechanical medicine. So the course I did was the RMIT Animal Chiropractic course. It's now morphed into the Animal Biomechanical Medicine course. It is still a graduate diploma, and it's currently delivered through the Box Hill TAFE Institute. So what do? You use your concept of proximal and distal points, and you use another part of the body to free up the bit that's stuck. So at this stage, I'd like all of you to sit up and stick your chest out and tighten up that thoracic part of your body. Now I'd like you to try and lift your shoulder, lift your arm up. Can you see how it's quite tight? And that's because your chest is restricting you from doing that. Now let's do the other thing. I want you to hunch your shoulders now and tighten it so you're like a hunchback, and try and lift your head. Can you feel that restriction in your cervicothoracic junction? So these are the things that can restrict movement. And how do we release that tension in your thoracics if you don't know how to adjust? Well, you can use it proxy. So now what I'd like you to do is do some shoulder rolls. So roll your shoulders forwards in a circular fashion 5 times. 4 and 5. Now go back backwards 5 times. And then have a feel of your thoracics. Do you think that feels a little bit looser? And that's the sort of thing we do when we've been sitting at the desk for ages on the computer. We can do the same sort of things for dogs. The second one says cycling. Now, cycling's gone out of favour with the rehabilitation therapists because they say, well, dogs don't cycle, that's not a normal gait pattern. We're not using cycling as a gait pattern in this case. We're using cycling like we do with the scapular rolls to release that tension in our lumbosacral area. And the same with the wrist rolls or the carpal rolls. When a dog is standing, it's carpal rolls. When a dog is standing, it's taking a lot of tension through those flexor tendons. By releasing that tension, you will actually change your postural tension, and that will affect everything higher up proximally. So let's have a look at the videos, the next video now. Hopefully it'll go the distance. So here's your scapular roll. I go 5 in one direction, 5 in the other, and then I turn the dog over and do the other side, and that will actually release that tension between the shoulder blades. Oh, I don't know these things. Okay, so let me stop there. We can, because we're doing this as an acupuncture webinar, we can tie this to a Chinese massage technique, a tweener technique called Yao Fa, which is described as a rocking technique, which unblocks the channels, smooths the joint, and is good for partially immobilized joints and muscle spasms. So you can see doing this ankle roll is a bit like doing a wrist roll. Do the toes, and we can relieve tension that way, and it's nice and easy. And that will affect the tension and the balance of the muscles proximally. Okay, so let's go back to the slides. Here we go. So tweener technique, Yao Fa, and it releases stagnation and releases our weight-bearing postural patterns. Okay. Now we come to the next concept of tightness. First we had stiffness, now we're looking at tightness. And to release tightness, we stretch. So there's active versus passive stretching. There's muscle and fascial tightness. And I'll briefly talk about when to use which type of stretches, what direction. And in this case, yes, you will have to use your knowledge of origin and insertion of muscles to help you there, and how much force to use. Okay, so with active stretching, you can't take it as far, so that's getting, it's like us lifting our arm up, and in the dog's case, it'd be like doing a high five with the dog. You can't take it as far, but you might have better compliance if you can trick the dog into adopting certain postures. One that I like is to get the dogs to stand on an elevated surface, whether it's on a higher step, and in that case, the dog's actually stretching its back legs out, but it doesn't know that it's doing it. Whereas, some of these dogs, when you try and stretch their back legs out, they don't like it and they'll turn around and snap at you. Okay. From a TCM point of view, tightness in the muscles can be due to blood deficiency or stagnation. And I've given you some examples of Chinese herbal formulas that I like using for these conditions. So there's Shujing or Shui Wan, which relaxes the channels and invigorates blood. Shentong Juyu Tang, which is also blood invigorating, and Body Saw is the Jintang herbal formula that's derived from Shentong Juyu Tang. Okay, so let's look at passive stretching. And again, we'll think about the concept of how much force, when to use it, what direction. And you can use aids to help you. So if a dog's lying down, you can put towel rolls underneath it. You can drape the dog over some fit balls. And we talked about that standing up stretch before too, where their front legs are higher up on the step. Now, this is my next tip, tip number 5, the counter strain technique. This is one of my favourite and early techniques I learned, and I use it in nearly every single musculoskeletal case that I come in. So there's a concept of stretching where you're pulling something that's tight, so I kind of think it's a bit like yanking. And then there's releasing, which is asking for that stretch, asking for that release. Early on, I learned to use asking techniques because dogs have teeth and they'll use them. So if you can do it nicely without pain and the dog's not upset, so much the better. What do I mean by counter strain and strain? So we are familiar with the word strain. It means to stretch something. So counter strain is the opposite of that, and it's to compress or squish. Now imagine you've got a baby and you're cradling it so that it's in a nice, comfortable position. And after a while, that baby relaxes so much that it becomes really, really heavy. But that's what we're after. We're trying to cradle that muscle in such a position that it's so comfy it relaxes. So this muscle is placed in a position of ease by releasing that tension in the muscle. And to do that, by squishing it, we're approximating the origin and insertion of that muscle. And by shortening this muscle, the hypershortening of the muscle fibers decreases the length of the intrafusal fibers and relaxes them. And it might take up to 90 seconds for the mechanoreceptors to reduce stimulation of the muscle contraction. So let's have a look at the video now. Here we go. So this is me approximating the psoas muscle. Psoas is a brilliant muscle to release with this technique. You know that the origin is around the transverse processes of the lumbar and down to the ilium, and it inserts on the, sorry, my cat just jumped on me. It inserts on the lesser trochanter. So by taking your knee up to the ribs, which is how I teach my clients to do it, and then angling that foot downwards, you're approximating it. And sometimes add a rib stretch to it as well. Let me hold it for that 90 seconds. So at the end of that 90 seconds, once all our cross fibers have released, we can take it into a stretch. Now, they don't always cooperate, so there's a couple of little tricks. Here we go, I'm rubbing the belly. So the tweener Chinese massage for that is described as Safa, and I call it the belly rub. Of course, you can use other parts of the body for the same kind of massage, but belly rub works really well in this situation. So let's go back to our slides. Okay, so there we go. We're releasing, we're asking for it, and then we're following up with the Safa technique. So this, and the other idea is not only to relax the muscles, but it's actually to distract the dog, so they kind of think you're just rubbing their belly instead of trying to stretch their leg. Okay, here we go. So sometimes even the belly rub's not enough, and this is a technique that I really like to release tension in limbs, so the back leg, front leg, shoulders, that sort of stuff. And I call it shake it like jelly. So the Chinese term is dofa. It's a tweener technique. And we'll have a look at the video here of me trying to stretch that psoas even more. So when you stretch a psoas, you've got to make sure that that knee is in line with the body and it doesn't flip out. And this is me doing the vibrating. And you can see after a little bit of vibration, see that leg go further back? And it's painless. The dog's nice and relaxed because all I can think about is that you're shaking it. So this is a YouTube video that I found on people, and this is it in a dog. This dog's not very friendly, as you can see, but you take it forward and you shake it like jelly so it loosens up. So you can do this sort of technique before you do stretches even. If it's too tight and you can't stretch it yet, try shaking it like jelly first. Okay, back to the slides. See. Here we are. So we talked about that psoas release. How else can we help that psoas release? Acupuncture have got good recipes with that. We can treat it using our ancestral sinews, the zhongxin. The opening points are gallbladder 41 and gallbladder 27, and the specific acupuncture points for the psoas are CV2 and stomach 25. And you've got the classical point of Jianjiao. So if I show you some pictures, so you've got gallbladder 41, gallbladder 27, you can see that's a local point. Jianjiao is in the same area, used locally. And here's the anatomy of it. So both of them will affect that psoas. CV2 is in this area, and stimulating the point here will release that tension, get that sacrum to, no, sorry, not the sacrum, the pelvis, the ilium to flip up and take that tension out of the psoas. The stomach 25 is just lateral to the umbilicus, and if you look at the ilium and this and parts of the back as the bow, then the rectus abdominis, which is where your stomach 25 is acting like a string. So if you release the tension in that string, you're going to release that tension in that bow. So I think I've talked that through. Here's our next part of the body. This is one of my favourite areas to examine and treat. Ribs. They connect the front legs to the back legs. They connect the front half to the back half, head and neck to the lumbars, and they're being used all the time. You don't stop because you have to breathe, so you're always using those ribs for respiration and movement. It's an integral part of the core strength and an engagement and propulsion from behind. Okay, how do we release tension in the ribs if you don't know how to adjust? So many of you have probably heard clients come in and complain that when they lift their dogs up, they're squealing when they're lifted up by the chest. This is where dysfunctional ribs come in. how do we do it? So here's tip number 6. You could try yoga breathing. With yoga breathing in people, you're trying to stretch that diaphragm to release the tension and get more oxygen into your system. In dogs, I stole this idea from the horse world. I get the clients, the owners, to cradle the dog's head, keeping the mouth closed so it can't breathe through its mouth, and then gently placing a thumb or a finger over one nostril. Now, in a third of the dogs, they'll take a few little shallow breaths, and then they'll take one big breath to try and get more oxygen into the system, and that's where that diaphragm can get stretched. In another third of the dogs, they stop breathing altogether because they think, oh shit, I can't breathe at all. So that doesn't work for those dogs. And then for another third of the dogs, they sit there and struggle, they fidget, they try and shake their heads to get away from you restricting them. So obviously it doesn't work for those dogs either. But in the ones that will do what you want it to, take that big breath after a few little ones, works like a charm. From a TCM point of view, when you've got restriction in that chest, we can use the daimai, opening the daimai vessel, the girdle vessel, to release some of that tension as well. So opening point, gallbladder 41 to triple heater 3 or 5, and the Chinese herbal formula, xia chai hu tang, to release the xiaoyang is very nice to go with it too. There's another way. So obviously the ribs and that chest cavity is very important to me. Tip number 7, if we can't do the closing the nostril thing, you could try a chest release by rocking that chest to release it. This is an osteopathic technique called harmonics, and I'll show it to you, but it's not hard. So let's have a look at this video. So this is my harmonic chest rocking to release that tension in that rib cage. Okay, so let's go back to our slides. Sorry about that. Okay, so on to tip number 8, treat them young. What do I mean by that? So I've had, over a number of years, I've had breeders bring puppies in, especially for swimmers, when the puppies are not strong enough to stand up on their legs, and you probably saw lots of the wrong videos of that just before. And I found that if they're weak in certain areas because of a restriction, if you can correct that early enough, you can actually you can make structural changes, because bony structures at that age are quite malleable. Once they're older, they kind of set in their shape and their pattern, and then you can only treat them for compensation. You know, the hip dysplasias and the bowed legs and that sort of stuff. Even the patella luxation. If you can get them early enough, you can straighten those legs enough to make a difference. So, as I said, swimmer puppies, I've seen some of those, and here are a couple of videos. So that we have to go back to the 9 and 10, I think. So this was a 3-week-old pug, and I know 3-week-old pugs are just blobs anyway, but this puppy in the litter was particularly flat and weak compared to the others. And then if you get them early enough and make the changes, you can see them when they're, this one's the same puppy 2 weeks later, 5 weeks old, and it's got a nice barrel shape at this stage and walking with its legs underneath it quite easily. So that's another thing to think of, treat them young. All right, back to the slides. Phase 2, gosh, we spent a long time in phase 1, patterning. So remember, we've got the regeneration and remodeling. So we want to get the correct pattern in this phase. Give the correct pattern. So if you want it to sit, it has to sit nicely, it has to sit square, it has to sit correctly, it has to get up properly, it has to walk properly. We want to try and make everything in the right balance and proper timing and sequence as possible. You're all familiar with the cruciate sit, one leg sticking out because there's restriction in flexibility of the hock and the stifle. So a simple thing to do is to get this dog to sit next to something, whether it's against the wall, a couch, or in this case a bucket, because that's all I had outside. That will encourage it to keep its leg in. Why do we bother? Because if it sticks out like that, it's not going to get any better. It's only going to get, you know, as I said, older, and then it's going to lay down scar tissue, and it's going to have restricted flexibility. So in this case, we want to try and maintain that flexibility and the right patterning right from the start, if we can. Okay, acupuncture for mobility and flexibility. I kind of just threw this slide in. There's a number of different techniques you can use. There's a balance technique. You can use local points at this stage because they're a little bit further down the line. You've got your 8 extras. So we talked about the Dai-mai, the girdle vessel, earlier on. I like to use the Do-mai a lot for OVDD or back problem dogs. So with patterning, we want to try and get proprioceptive retraining. Lots of dogs that, you know, if they've got a back problem and they're knuckling over, they've got reduced CPs. These are some useful little tricks to get the messages down to the back, the feet. Let's look at some videos. So we've got tickling the back, nice and gentle all the way down. I say to people, if you're doing a massage down the back or skin rolls, you're working on those muscles that are tight. But when you're doing a subtle tickle like that, you're actually affecting the proprioceptive receptors deep in the joints. And this one I learned because when my daughter was little, she used to give me back scratches because I was always tight in my back, and the scratches would help release the itches. And I discovered after a while that if she gave me these scratches regularly, I wouldn't be as tight in my back. And I thought, well, that's a nice, easy technique that my clients can use. Okay, so then you can go down the back, down the legs, and this will come up in a minute, tickle the feet. You can use an electric toothbrush in this case, but tickle it all over. Now, this is a little bit similar to the tweener technique morpha, which is again very gentle, touching of the skin and muscles. And it was described by Bruce Ferguson in his tweener notes as the good dog technique. Regulates chi, removes accumulation, and drains stagnation. It's the autonomic approach to the somatic therapy. Okay, last one. Oh no, not quite. Another way to help with proprioceptive retraining. We're all familiar with the concept of having a pebble in the shoe and really irritating us, so we have to stop straight away and try and get this shoe pebble out. So we can utilize that little trick for our dogs as well if we have a look at this next video. So I've got this dog that you see with a hair scrunchie on its front foot. Now remember, this is the same dog that had the cruciate repair on its left hind leg. Why have I put the scrunchie on a good foot? So that we're distracting that dog. And it's thinking, what is going on with my foot? And it's forgetting about that back leg. So we're trying to encourage it to forget about its back leg, so it's not holding that leg up and it's using it a little bit more. Sometimes, you know, if I say this to a man, they look at me very blankly, and then I grab my roll of masking tape, grab a whole heap, make it into a wad and shove it up the pad of the foot, and that can work quite well. To enhance this experience, you can put little bells around the carpus or the tarsus so that you're getting an auditory input, not just a sensory input. Finish that. Okay, so that one's done. We'll go back to the slides. Go proprioceptive retraining. We're nearly at the end. Here's another example of proprioceptive retraining using an obstacle course. So ladder on the ground works well. I set up an obstacle course so I can actually vary the height of the obstacles and the distance apart. when I did the CRI training, they encouraged us to use just whatever we had in hand. So I had some bamboo sticks and I placed them on tin cans. And you know what? Every single dog looked at it with disdain and just kicked it all away. So I thought, right, bugger it, I'm going to get the better of you and make something proper. But you don't, if you don't have this, not all my clients do. I send them to places with uneven surfaces, so playgrounds that have tan bark. My neighbour's got pebbles in her driveway, so we use that a lot. Even longish grass, so they have to lift your feet over the grass, can be useful. A wobble board, so if you haven't got a wobble board, you can use, as I said, a blow-up mattress and get the dog to walk on it. And we can utilise water, which I'll explain in a little bit more detail when we get to the water part of it. Okay, so now we're on to the phase 3, reinforcing the pattern, and this is where strengthening becomes important. So in this case, we want to strengthen the timing, our coordination, the movement, and the muscles. And it's important to strengthen the ability to do all the things, not just to walk, because then when you're running, you're not strong. So you've got to be able to be strong in the walk, the run, the jump, and whatever activity the dog is normally doing. From a Chinese medicine concept, we're improving our qi and blood here. So these are just some acupuncture points I picked out at the top of my head. The spleen, Chinese organ, is important in controlling blood, muscles, and the limbs. Here are a couple of Chinese formulas, Shi Qian Da Bu Tang, that will do that. So qi and blood tonifying. This is apparently one of the most popular formulas in China in the elderly to keep their vitality up. Bu Yang Huan Wu Tang, again, tonifies qi and invigorates blood. And I use that in the latter stages of IBDD dogs that need strengthening in the back end. Okay, my last tip number 10, strengthening. We can go up hills, we can go down hills. Now, how many of you recall that when you go down hills, it really hurts in your knees, puts a lot of pressure there? So if we're looking at our cruise ship model, I do encourage you, when the dog's going downhill in the early stages of strengthening, to do a zigzag path rather than go straight down the hill. Hydrotherapy versus wading. Hydrotherapy, we're kind of thinking of the underwater treadmill that's becoming more common. And if you think about what hydrotherapy does, when the dog's in it, it's pushing its leg forward against the water resistance, and when it places its foot down on the treadmill takes that foot back for it. So the work is all in pushing the leg forward, building those hip flexors, building those shoulder extensors, but not so much for the triceps and the hamstrings and the gastrocs. Versus wading, so obviously that has to work both ways because there's no treadmill to take the leg forward or backwards. Now, what's the difference between using wading versus swimming? If you look at these dogs swimming here, you can see that their back is quite arched in a lordotic posture, their head's up. And if you were to look in the water, you could see that the front legs are working really hard to keep that head up, and back legs are kind of making little circular motions. So not really good if you're trying to strengthen some of these hamstrings and those sort of muscles. And especially in the old dogs that have got a bit of stiffness in their spine, not a good thing. It's too hard for them. Swimming can be appropriate if dogs will cope in a life jacket, because then the life jacket keeps them afloat and all they have to do is paddle to go forwards. Now, if we look at the wading dog, depth of water is really important, and it will do different things depending on the depth of the water. So this dog is in quite shallow water. It's just up to the hock and the carpus. And in this case, its main action is to try and lift its feet up out of the water, so good proprioceptive training here. If it was deeper, like shoulder and hip deep, its main function there is to support the weight of the dog. So good in the initial stages of strengthening. and also good for shoulder and hip problems. The hardest work is actually at this belly level, belly, elbow, stifle level, because that creates, the water creates the most turbulence there, so it has to work the hardest. So they're kind of, you know, a few little take-home rules there with it. And obviously we've got steps and soft sand later down the track as well. So if we have a look at the last slide, we did say 10, but here's my little freebie. Rehab will be easier if nails and feet hair are clipped during surgery or before rehab to minimise tension on slippery surfaces. So when you're clipping that stifle for cruciate surgery, it doesn't take much more effort to go and clip the hair off the feet as well. And why do we bother? So recall back to the last time you stood on a floor that was slippery and you thought you were going to slip. What do? Immediately you're going to tense up, and you're going to tense up all these muscles if you've already got an injury that are already tight and sore. So that's a really important thing. Rehab is not going to go forward as easily if they've got tension because they're trying to stop themselves slipping. Slipping will also cause more injuries anyway. So then you encourage your owners to put non-slip mats down, or to get little booties for the dogs. So there you go. That's my take on the top 10 tips. If you found that useful in any way at all, stay tuned, because on Wednesday the 22nd at 8:30, so same bat time, same bat channel, we've got the next 10 tips. Thank you very much, everyone.
Okay, thanks, Kim. That was a great presentation. We do have a question that's popped up. So Nicole would like to know, do you have to be careful of hemivertebrae in some of the brachycephalic breeds like Frenchies when you're doing that rocking technique? The ribs, I guess. I probably wouldn't do it in the early stages. And you would, yes, definitely. I've never done it on a Frenchie because it's too risky if you're thinking of that. But I would have a different technique, and I might even introduce that in the next 10 tips that would be quite suitable. Would have a different technique, and I might even introduce that in the next 10 tips that would be quite suitable for the hemivertebrate type dogs. So stay tuned. You're going to find out some more. And if anyone else has any questions, you've got half a minute, maybe more, to type them into the chat box there. I realised when I started that I was so keen to get started on the webinar, I didn't actually introduce myself. So for those who don't recognise my voice, my name's Claire Ellis. I'm the current AAVAG president. I should also say I've been doing the canine rehab course along with Kim and have found that it has been an amazing addition to my acupuncture practice. It feels like I've discovered the missing link. You certainly don't have to be a certified practitioner to start using these techniques, the ones that Kim has introduced. And I hope that all of you will find that there's something out of Kim's lectures that you'll be able to take home and start using in your own practices, you know, from this week basically, and you'll improve your outcomes so quickly with such simple, logical kind of stuff. It's so amazing once you start using it. It's very easy to do. Clients love it, and you'll get great results. Now, we've got another question here from Cindy. Can we assume that all these techniques in dogs are from those that didn't go for surgery at all? No, you can use these techniques for surgical or non-surgical dogs. And so it's not so, you know, it's not so much a surgery. It's, as I said, is it stiff? Is it tight? If it is, this is what you can do. Now, thinking back to the hemivertebrae, the technique you've already been shown is to do shoulder rolls. That will release that tension. Cool. Okay, well, if there's no other questions, I'd just like to say thanks very much to Kim for her first lecture in our rehabilitation series. As Kim has already said, the next one will be on the 22nd of November, so it'll be great to see you all at that one again. Hang on a minute, we've got a last minute question sneaking in. David says, when do you start when do you start rehab post-surgery? Well, as I said, you can start from day one. So you can, you know, when we were doing the joint pulse, you could see the stitches still in that dog. So that was in that first week. If you do a joint pulse in that first week, it's not going to harm the dog, but it's going to help get that circulation going, get that swelling down.
And even the flexibility is fine when you're going nice and gentle. So get onto it. Now you've got some tips, you know what to do.
Great. Thanks, Kim. And we're hoping to also, well, we will be holding 2 more rehab webinars early next year. The dates we haven't decided on, well, there will be one in February and one in March to finalise our rehab series. So keep an eye out for those coming soon as well. Otherwise, thanks to Kim, thanks to John, who's our behind-the-scenes redback helper. And good night, everyone. Thank you.
Thanks, Claire. Thank you.